When Stephen was ill, we needed to find a complementary way of how we were going to deal with the disease, that it was not only being attacked from a Western point of view, but how we're going to help him through Chinese herbs and acupuncture and yoga and all these wonderful modalities that really supported his sickness and also supported us as a family. Imagine a healthcare system where the patient is treated, not just the disease. Imagine a system where Eastern healing techniques are used in combination with Western medicine in a holistic approach to patient care. The Urban Zen Integrative Therapist Program was created to realize this vision.
Integrative medicine is an approach to working with patients that looks to combine the best things about conventional medicine with the best things about other kinds of healing arts, what have been called complementary alternative approaches.
Through Eastern philosophies of yoga, meditation, aromatherapy, Reiki, nutrition, and palliative care. 5 modalities that were put together to treat pain, anxiety, insomnia, nausea, and constipation.
What it does is it has a foundation of conventional medicine, but it blends into that whatever works best for the patient.
When I think back to like about a year and a half ago, everyone was like, yoga, how is this going to work? You know, how is this going to... But it's gotten so integrated.
And a lot of people said yoga. I mean, yoga helping in the hospitals. I can't even barely move my body in a hospital bed. And we came up with some really wonderful in-bed movements that almost anybody can do.
My issue right now is my ability to use my legs to support myself. If I can work with my feet, the lower limbs, and even do things with my arms and learn how to breathe, and that's all going to benefit me physically. If I say I have pain here, then they'll find exercises for me to do here. Or if I say, you know, this foot is bothering me, or well, whatever it is, they're very open to where I am, as opposed to coming in with an agenda or a program that says, okay, today we're going to do this.
I go into a room and I can assess, are they in pain? Are they in fear? Are they having insomnia? And then say, okay, what would help? Would Reiki help? Would movement help? Would setting them up more comfortably help? Would doing aromatherapy help? Would just sitting and being witness to them help? My father just had a septal bypass a couple of months ago, and my husband and I spent many, many hours in the hospital with him using these tools.
There's a holistic nursing approach, which is a set of trainings that all the nurses and nurses' aides on our floor received over the last year.
When I came upon this training, I had already been working at Beth Israel in their cardiac rehab department and pulmonary rehab, working with people with heart disease and pulmonary disease. And this training seemed absolutely perfect as a marriage or a blend of using my clinical nursing training and being able to expand that into the more holistic, integrative modalities.
We'll have sometimes patients who'll have symptoms, like they'll have symptoms like constipation. And then the yoga therapist will come in and they'll do certain poses with them and encourage them. And then later on that evening, you know, success.
The key, I think, of this work, that it's not some esoteric, you know, fancy intellectual idea, that it's actually expressed physically through the tools of yoga therapy, breath awareness, meditation, the essential oils. You know, they all have a very, they're active, they're proactive.
I think it's transformative. I think that this concept of healthcare, which has been underappreciated, is beginning to take on a life of its own. And I am very grateful to Urban Zen and to Donna Karen, obviously, for having the vision, but also I'm very grateful to be here at Beth Israel and to be able to be amongst the first institutions that are really embracing this.
We tested the hospital before the intervention of our modalities and then after the intervention. What has been streaming into my ears from not only the practitioners, but the patients, the doctors, the nurses, the administration, they've all said, we can't believe the effect you're having in the hospital.
If you have something like this offered and available, offer it. Patients love it. It's a way of taking care of patients. Staff love it. It's a way of taking care of staff. If you have happy staff, you'll have happy patients.
One step at a time, taking it and placing it in different states for now. Eventually countries, to give them the opportunity to take this to their community with our curriculum that we've already tried and tested. And one step at a time, just spread the news, spread the information, spread the love.
We have to hit it on an educational level. We have to hit it on a hospital level. We have to hit it on a doctor level. We have to hit it on a university level. Every single part of us has to realize that our healthcare system is about caring for health.
I am Victor Medina, and I'm suffering from tonsil cancer.
And again, feel the movement of your breath, the way that the chest rises and falls, the way that the sides of the body expand and contract. And whenever you feel ready, you can allow your eyes to open.
It's okay to fly?
It's okay to what?
It's okay to fly?
To fly?
Yeah.
So if I had to ask you what the pain is from 0 to 10 now, what is it?
I'm flying now.
You're fine. So it's probably, what, 0?
Yeah.
So even if it comes back to a 5, to know that there's a way for you to bring yourself to 0 sometimes.
Yeah.
And to just be with whatever's happening in your body. As frustrating or as painful as it sometimes is.
What's up there?
Help us help you create the ultimate healing experience at hospitals, at schools, at teaching facilities. We cannot do this without your help. Thank you.